did you know that over 90% of women between 18 and 50 have used some form of hormonal contraception, whether it's the pill, patches, hormone editing IUDs, or implants, at some point in their reproductive years? Yet when it comes to hormone replacement therapy, the numbers are still tell a very different story. And here to talk more about that, we have Dr. Tammy
Hey,
Tucker.
Dr. Tammy.
Hello.
Hello, hello, hello.
Hello.
So good to
Thanks for
see
being
you.
here.
So good to be here.
Can you kind of talk about this problem for us?
It's amazing. You know, it's funny, just a week or so ago, I was in the green room waiting to come out, and there was a young girl, just absolutely beautiful, asked me what I do, and of course I say I'm the menopause queen, and I help mostly women with menopause, and of course perimenopause and younger too, but it's just fascinating because I said that, and she said, oh, my mom needs you so bad. And I thought, that's great. And then I thought, I wonder, like, what's going on with her that she said that her mom needs me so bad?
Yeah.
And then the next thought was she came back and said, oh, but she never.
She'd never reach out.
Yeah, and I was like, well, why? And she said, because hormones cause cancer, and she's terrified of it, and she won't even talk about it. And I thought, here's this beautiful girl. And it's funny, you had Dr. Spencer on earlier.
Right.
I love Dr. Spencer. I won't even say how much I love him. But after menopause, you know, we start needing Dr. Spencer. But you know, my thought was, here she is with this narrative. And then I'm thinking, this young girl, what are the odds that she has been on hormones at some point?
Right.
And doctors just throw that out, and those are synthetic. And then we're talking about bioidentical natural hormones that change everything, make you need, you know, plastic surgery even less. And then there's the weight gain, which always brings women in. So I have to mention that because, you know, if you're struggling with hot flashes and you're just sucking it up and being, you know, just this martyr, what about the weight gain? You know, and women gain anywhere from 5 to 15 pounds a year. And so, yes, those are maybe considered vanity, which I don't think so, because if you dent your car, you're going to fix your car, right? You're not going to drive a dented car around. But as we age, what's wrong with that? You know, to try to focus on that. But from the inside out, if your hormones are making you, you know, literally dry up everywhere, plastic surgery isn't going to do that much.
Yeah.
And trying to lose weight, there is an obesity rate of over 70% of menopausal women. They gain 5 to 15 pounds a year. And it's, we don't have to suffer. We don't have to suffer with the mood swings. We don't have to suffer with not sleeping or not feeling our best for our families. And we don't need to dry up. And it's like, when it comes to contraception or it comes to not getting pregnant, suddenly synthetic hormones are perfectly okay, and they write those all day long. Over 90% of women have been on some form of birth control.
Sure.
And I think every woman knows someone who has been on birth control at some point. And nobody ever thought that was dangerous or was going to cause breast cancer.
And Tammy, to help people, you've set up actually a website, right? HormoneBliss.com. Can we talk about that before we let you go?
I'm so excited about that. And it was just kind of born out of women just needing the education, being on shows like this with you guys, thank you so much, having my TikTok, my Instagram, and getting out there and spreading this word. My goal is that 50% at least of women who will be on some sort of bioidentical hormone therapy before the end of my life. That's what I'm passionate about. And just helping women at least have an informed decision that they can go to their doctors and be empowered and say, hey, I want this. But if they can't, because the narrative is, okay, once we call it HRT, now it's dangerous and it causes cancer, which is nuts, born out of a lot of misinformation, if you will, but making it accessible and affordable. So all you do is you just go to HormoneBliss.com and just take a test, see how bad your hormones really are, and just kind of put those symptoms together and like ding, 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 you know, now you have this correlation, and then you can decide and then, you know, watch the educational stuff.
You heard it right here. Reach out. HormoneBliss.com is the place. Dr. Tammy, as always, thank you for dispelling myths. We appreciate you.
Thank you, thank you.
Yes.